In this video, I want to explain exactly what Optilite IPL is and why it works for dry eyes. Dry eye is not a tear problem. It's an oil problem or a tear quality problem, and that changes everything. Most people think that dry eyes means that you don't make enough tears, but that's not usually the real problem. Your eyes are surrounded by all these little tiny glands called meibomian glands, and the job of those glands is to put an oil into your tears, and that oil acts like a lid on a pot. It slows down the evaporation of the tears on your eye. But when those glands get clogged or inflamed, which is really common, you don't get a high quality oil into your eyes. You get kind of a clumpy oil or not much oil at all, and your tears evaporate way too fast. In meibomian gland dysfunction, or MGD, the consistency of the oil changes, so instead of coming out kind of like olive oil, it comes out like toothpaste. And that's when the front of the eye gets exposed to air. The little nerves that are usually only triggered when something's in your eye start to get triggered just by air touching them. So your eyes will start to water a lot, or maybe they'll feel sandy or gritty, or they'll look really red, or they'll be itchy because it's inflamed. That whole process is dry eye disease. If we can treat that meibomian gland issue, then we can treat the dry eyes and your body can kind of repair itself. And there are some ways to do that. The most popular way is through a treatment called intense pulse light. IPL delivers very high energy lights at specific wavelengths for very specific amounts of time and kind of these pulses. And with that, we're able to target specific tissue. I love this demonstration of how IPL works. There's a red balloon inside of a white balloon. That light hits the balloon and the red balloon will pop and the white balloon stays intact. This really shows how this energy is being delivered to the skin, kind of bypassing that front layer, but going in and targeting the tissue that we want to address and change. And in a way, it lets us kind of repair those meibomian glands. Around the eyes, we'll often see little pro-inflammatory blood vessels. We call that telangiectasia. Those little vessels will kind of wrap around those meibomian glands. They're very leaky. If you have facial telangiectasia or rosacea, if you see those little blood vessels kind of growing out on your face, there's a really strong chance that those blood vessels are in your eyelids and they're having an effect on the quality of the lubrication of your eyes. And they cause a much lower quality oil to be secreted from those glands. Sometimes the glands become so thick and clogged up that they'll just die. IPL allows us to target those little telangiectasia vessels, and with that energy, we cause them to essentially denature. That's one of the things that made IPL famous in the beginning. It was used to smooth skin tone. It takes age spots off of the skin and it makes those little blood vessels fade away. So people liked that cosmetic effect. But when people were going in and getting their cosmetic treatments, they were finding that frequently people would have less issues with their eyes. So that was studied. But for years it was used as an off-label treatment for dry eye disease. Now it's FDA approved and it's gone through many studies, and the results have been pretty impressive. So the treatment has multiple benefits. Some other things that it does is it kills some of that bacteria around the eyes. It kills the little mites, those Demodex mites that will live on our lashes, which cause inflammation. And it'll also cause a skin shock reaction that seems to have an anti-inflammatory effect. We've actually been able to observe the regrowth of atrophied meibomian glands, which has been very surprising to me, because we used to think that when those glands atrophied, they were just gone. There's also a lot of heat that's generated with this, and so in some cases, some of the oil there that gets solidified is melted and it will express away a bit easier. There is a little bit of a discomfort in the moment of the pulse of light. It is a lot of energy. We're delivering enough energy to make changes to your body, but it's really not too bad. Generally what people say is it feels a little bit like a snap, like a rubber band sort of a snap, for just a second. But unlike a rubber band snap, it pretty much instantaneously feels fine right afterwards. It just hurts for just a moment and then you're fine. The treatment is very bright. You'll have these goggles over your eyes and your eyes should be closed during that treatment as well. And even so, you'll still see a bright flash of light. And on some occasions, if we have a sty or something specific we're treating, we may put corneal shields in your eyes, but we can discuss that before your treatment. For an IPL treatment, you're going to want to have your face completely cleaned off, so it's best to not come in with makeup. Anything that's pigmented can't be on the face, so sometimes people will say they don't have makeup, but they might have sunscreen that has tint in it. But that would be a big problem because that light's going to heat up that pigment and that can cause little burns on your face. So coming in for the appointment, it's important to have the face completely clean. Once you're comfortable and set up for the procedure in the chair, a cooling coupling gel is applied to your face, which is just a liquid-based, kind of like ultrasound gel. It helps to get a nice even energy delivered to the skin, and it kind of has a nice soothing feel as you just kind of lay there relaxed with your eyes covered. Personally, from my experience being treated, it's not that painful of an experience, but it is a little bit of a jolt every time that that light goes off. I've really noticed changes and improvements in my own eyes, and also in my skin too, as a fun side effect. I've done this treatment on hundreds of patients. I've seen lots of different types. I've seen most people get improvements, some of them fantastic improvements. Some of them not as good of improvements. I've had some that I've been disappointed with the results. I cannot guarantee that it will work for you. I can point out a lot of study data and I can tell you why I think it should work, but there's always a little bit of a gamble with it. We're always really careful with our patients, and I like to tell them, you know, it's a treatment, so sometimes we have a little bit of anxiety coming into it, so what are the risks? The biggest risk that I feel that you have coming in to get a treatment is that you're not going to get the results that you're hoping for. But most people do get good results. And a lot of the times I feel like people who didn't get as good of results, if they had kept on coming and doing additional treatments, they probably would have eventually achieved those results. But I also don't want to drag them along and keep on doing those treatments. I want everyone to feel comfortable and to want to do more treatments. So I completely understand why at a certain point they may have said, you know what, that's enough for now. There are a lot of different things we can do for dry eyes. There are a lot of great medications out there now, and things that you can do to kind of maintain the eyes. I love the treatments for the eyes because I really like the idea of getting your body to take care of itself. So if we can kind of take those eyelids back in time and improve those oil glands, that is a treatment that I think is worth pursuing versus putting a chemical on the eyes, although it can be very effective, but if you don't use that chemical, then it's gonna not work. You have to use that in order to have improvements. And so it's just a great option for people. And it's a great way to interrupt that cycle of inflammation. This meibomian gland dysfunction, this inflammation, it's this inflammatory cycle. And so you can kind of get in the way and use it as a tool to improve the tissue and to reduce the inflammation, make your body work a little bit better at lubricating its eyes. IPL is an energy-based treatment, so it's all about delivering enough energy to the body for there to be a change in the tissue, and that change takes time. The FDA protocol to prove efficacy for IPL treatments for dry eyes had 4 different treatments. They were spaced 2 to 4 weeks apart. Typically, that's what I recommend for patients as a minimum. After that first treatment, every once in a while, I'll have someone tell me that they're feeling better, that they notice some improvements. But usually they don't notice improvements yet. The second treatment, they'll come in, we do that treatment, and they still might not feel like they've gotten any better. After the third treatment, most people are noticing some improvements. They're feeling a bit more comfortable. They don't remember to put in their drops as often. After the 4th treatment, I'm very hopeful that we're having some very noticeable effects. But after that 4th treatment going forward, they will continue to have some improvements. Now, I'm starting to lean more towards the thought that for every decade of life, you might need an additional treatment. So if I'm 60 years old and I have some significant dry eye issues, then I might need to have 6 treatments in order to feel like I have made a real significant change or improvement to my body's ability to lubricate my eyes. Everyone's a little bit different. It depends on how much atrophy there is and how you respond to the treatment. Now, the treatment is not for everyone. Because that energy is going in and it is being absorbed by pigment, if you have very dark skin, it won't work as well for you. I found a very wide range though. I've been surprised at how dark of skin we've been able to treat with great success, but we do need to be cautious. So we want to make sure we look at that and talk about that before you do your treatment. If you have any other questions or concerns about IPL, or you want to hear any experiences about the best or the worst experiences I've had with it, then comment below, let me know. I'd be happy to address those questions the best I can. Thanks for watching.